it's my great pleasure today to introduce our guest speaker, Linda Krupski. Linda is one of the co-founders of LovExtension. She founded this group of volunteers with her sister, Nancy Hartkop. And it's a 501c3 that has a large group of volunteers who deliver food to the homebound, disabled, poor, and those without transportation. LovExtension serves about 600 clients, and they work providing food in and around Lake County and the villages. Rotarian Carolyn Willette also volunteers with this program, a member of our club. Linda is a lifelong resident of Lake County, Florida, and formerly worked with the Lake County Sheriff's Department, Office of the State Attorney, and Clerk of the Circuit Court. Yes, and so again, services provided by LovExtension include social visits by a volunteer if available, food to help stretch a fixed income, or other items and resources. So again, thank you so much for joining us, Linda, and I'll turn it over to you.
Thank you. Thank you for the opportunity for Nancy and I to speak to the eRotary. It's fascinating where we've come. We are getting a little more used to Zoom, so bear with us. LovExtension was founded 19 years ago. No one makes a salary, and we are all volunteers. We serve all of Lake County and the villages. I was a caregiver for my parents, and at one time, our mother had to be in a nursing home for a short period of time. Nancy was the away daughter. My dad and I would visit Mom at the nursing home twice a day. One day while we were there, an elderly gentleman became very weak, and we asked him if we could drive him home or follow him home. He said he would appreciate us following him home. When we got to his home, he told us he had no food in the house, that his wife was in the nursing home with Alzheimer's. And so we asked him if he had a microwave and if he knew how to use it, and he did. So my dad and I went to the store and got a bunch of food that he could prepare in the microwave. I then returned to the nursing home and told them what the situation was because they knew we'd followed him home that day. They made arrangements for him to eat at the nursing home with his wife. It's just until this gentleman reached his breaking point and told someone what was going on, no one knew. Seniors don't always want people to know what's going on. They don't want their children to know. They don't want to risk being removed from the home, and they don't want to worry their kids. Our first grant was from the Lake County Board of County Commissioners to take on isolated and lonely seniors living in their home. Up until this point, we were only seeing seniors in facilities. This grant would open our eyes to the real struggles seniors in their homes were having. One of the conditions of this grant allowed us to provide one hot meal a week to the seniors that we took on for the grant. At the end of the grant, we asked each one what the one hot meal meant to them. A 98-year-old said, "Linda, go look in my refrigerator. You won't find any food. At 98, you don't feel like cooking, and you're afraid if you do, you'll burn your house down." Another one, a retired registered nurse, said the one hot meal a week helped her to realize how depressed she had become. She was to the point of eating cold soup out of a can because she didn't have the energy to heat it up. The one hot meal helped her to realize how low she had sunk and start doing something about it. And she is still doing fine today. She is grateful for what we presented her with that meal. LovExtension served 609 seniors in 2019 and approximately 500 with a bag of food. We have seen what happens when a spouse passes away and the income is drastically cut. We have clients living on $650 a month, and many of our clients only receive $16 in food stamps. It's not much. The unbelievable thing is that our clients cannot buy toilet paper, detergent, toothbrush, toothpaste, and other personal care items with food stamps. If it's not edible, they can't use it for that. We give out a large amount of pull-ups, diapers, poise pads, guards for men, bed pads, and even Ensure and Boost for the more fragile individuals. We also give out gently used medical equipment. In Tavares, we have a very small office, but we are able to do big things with it, and we are grateful for it. We have several groups come each month, several times a month, to bag food for over 500 homebound and low-income seniors. And then the food bags are delivered to them by one of our 29 delivery teams. A one-page food survey is done for every client taken on our program. We want to cut down on waste, and we want their bag filled with items that they will eat. If they don't eat beets and tuna, we don't want to give them beets and tuna. Many of our clients are having to make a decision between food and medication. If they own a pet, they will buy the very best food for their pet. If there's a choice between food for themselves and food for their pet, the pet wins. We have been asked how COVID-19 affected our LovExtension clients. We have been through devastating hurricanes, but COVID-19 was so much worse. It shut down a whole country at the same time. The shelves in grocery stores were bare. The meats and fruits and vegetables were gone, if not completely, almost gone. There was no toilet paper, no paper products, no cleaning supplies, not even hand sanitizers, gloves, or masks. They were non-existent. We had very scared clients, and still do today. Many of our people were calling for help and that did not want to go to a grocery store, did not even want to come out of their apartments. Two of our clients, luckily only two of them, wanted to be placed on hold because they did not want anything coming from the outside into their apartment. Lake County has a 501c3 called LASER, which stands for Lake Support and Emergency Recovery. LASER was able to help our organization with sanitizer, gloves, and masks. It took a couple of weeks to provide them to us because they were trying to get the healthcare industry taken care of and the medical people taken care of first. It took a couple weeks, but we got them and we are using them. At this point, we did not know whether we would be able to stay open or not. We were serving 600 seniors, and if our volunteers were not willing to help, we could not do it by ourselves. The safety of our volunteers and clients was utmost in our mind. Some of our volunteers were not willing to participate during this time because of their health conditions or the conditions of their family members. We understood this. However, we were blessed with other volunteers that were willing to step up and risk their own health to serve our clients. We contacted Operation Homebound in the villages, who delivers 200 hot meals each week, 5 days a week, to clients. They were shutting down because they have mostly older volunteers, just like we do. This concerned us because we serve people, we provide food for the weekend because they have people that are receiving free meals and cannot afford the free meal. And so we figured if they can't afford the free meal during the week, they can't afford the food for the weekend. So we felt like we needed to continue to do this. They couldn't do without, especially with having to be without the hot meal. So our people were thrilled that we were willing to risk our lives to bring them food. And Operation Homebound was very pleased. We were fortunate that we just ordered 15 cases of toilet paper before all of this went down. Toilet paper is the #1 item our seniors request. We have used up all of that we purchased, and we are struggling to find it just like everybody else. We usually give out a 4-roll pack each month, but sometimes right now we're down to 2 rolls. But Nancy and I looked at it that 2 rolls were better than no rolls. But if we can find the 4 rolls, we give them the 4 rolls. Regarding the food, we contacted Southeastern Food Bank in Ocoee. We usually deal with them. We said the situation is crucial. We need help. He stuck by us the whole time, and we made several trips to Ocoee to pick up food. In fact, one of the trips, we picked up 45 cases of Dunkin' Donuts chicken salad wraps, and we dispersed those to 10 senior communities, not just our clients, but everyone that wanted a sandwich. This was a huge donation, and one that we were grateful for, that pleased everyone that received the sandwich. Who would have thought? We also distribute fresh fruits and vegetables to senior communities when we have them. They love it. Fresh fruits and vegetables are something they can't usually afford. Southeastern Food Bank has been serving LovExtension for 10 years. Everything they do is free and always has been. He has provided food, medical equipment, incontinence supplies, including 12 pallets of brand new packages of adult pull-ups, pallets of Ensure and Boost, protein bars, household items to help seniors, and even prizes for our bowling extravaganza. They were with us through this entire situation, making sure we had what we needed and what our seniors needed. We will not forget this. Laser Agency has been with us and has donated 9 pallets of boxes of food to go to our clients. These boxes contain 7 additional meals, snacks, breakfast items, and juices. Another business that was a huge benefactor for with us obtaining food was Save-A-Lot. We usually deal with Save-A-Lot, and if they could get it, if they had it, if they could get it, we received it. Aldi's was one of our resources, and they only allowed us to have 2 cans per item. It wasn't worth us going to the store to get these items. Walmart shelves were bare, and so was Dollar Tree. Channel 9 did a segment on LovExtension, and they saw our picture when Laser was delivering boxes of food to our office, and they called us to ask us to do a interview with them. It was the day of the tornado warnings and raining, and they were supposed to do 2 interviews on new test sites in Lake County, but because of the tornado warning and the rain, they couldn't do it. So they called us to see if we wanted to do an interview. Well, my hair got rained on, so I wasn't real excited about doing an interview on television. But I said, can we do it on Monday? They said, no, because, and they explained about the testing sites, and that fell through. So we said, let's do it. So what I realized is and we got calls from all over after that segment was shown. But what I realized is that people seeing that interview on television did not care if my hair got wet. They didn't care that my makeup was not up to par. They didn't, all they saw was we were a lifeline between them and the help they needed. And we've been adding them to our service and serving them. How did our clients react when our delivery teams started showing up with the food bags after the virus shut everything down? They were totally surprised and shocked that we came with food bags. Some cried, some kept saying, "Thank you, thank you, thank you. We didn't think you would be able to come or find food to put in the bags." All of the delivery teams had the same response from people, and we discussed how grateful and appreciative they were because of risking our lives to help them. We literally showed our clients we cared for them and their needs rather than just being food providers. This meant a lot to them. Since the virus, we have probably added approximately 100 clients. Thank you. I hope you understand what we do and how much we love doing what we do. Thank you. Thank you.
Linda, that was great. Carolyn's still trying to get in. Gloria, our president, has joined us.
Hi, Gloria.
Wanted to ask, what do you feel is the most important thing they need besides food and toiletries? Is it connections to numbers for support? Is it the elder council? What do you provide them that can give them those extra helps?
Hi, Carolyn. I see you.
Well, hello,
Glad you
Linda.
finally made it. I finished. You know what I was thinking about, and I was going to talk to our chairman of our board. He's a quadriplegic on a ventilator, but talking to you, I think one of the nice things that would help is if we could, on Zoom, for those that are, feel more comfortable staying inside, doing trivia or something that could keep the mind working. I think, or bingo or something like that. So when you get out of the hospital, Dr. O, maybe we can talk about something like that.
Wonderful.
But
Yeah.
I think that would, so many of our people are so low income, they can't afford to go places and do things. And right now they don't want to come out of their apartments. Their health conditions are very fragile and they don't want to risk that. But maybe we could bring life with Zoom.
That would be wonderful. Now, I think what I was getting at, though, is like, I have a list that I used to give out at my store when I owned a store here, and that I give out to anyone that needs it, that asks and calls, here is a food bank you can go to or call. Here is the elder council number. Here is the Catholic Charities number. Here,
Yes. We have books put out by Lake County that we can give to people. Yes, that will help them know all of the pertinent numbers, elder abuse, all of those numbers.
And do you do an intake screening conversation with them and a preparation for your visits, or do you just drop them off food?
No, we try to do an interview and find out what their needs are. Some want a social visit, and then we try to, the social visits are off right now. But if some have food, but some just need a social visit. We try to find out what their needs are and how we can help them. And as we get more volunteers and see their background, that can help. So we have a lot of seniors that are depressed just because they've lost their spouse and they can't move forward. It can be tough. And because their income has been cut in half and things are harder to afford, and everything keeps going up, and we're getting ready to see that with the cost of food right now. That's going to bring more depression and more needs.
I have a question. Have you been approached by any of the, can you hear me okay? You might speak louder.
Of any of the what?
Oh, can you hear me okay? Do you want me to speak louder?
Yes,
Or,
yes.
okay. Hold on, let me put my, let me raise my speakers higher so we can hear each other. All right. So have you been approached by any hospitals or any associations, for example, the American Diabetes or the Heart Association? Oh, my doorbell's ringing. About passing out information. I'm sorry, I have to get this.
Well, we do try to put informational things in our food bags. We try not to overwhelm the bag with stuff, but we have found that they will read it if we put a few items each month in there for them to read. Things on eating better, and we've even tried like 3-ingredient recipes, because we figure most seniors don't want to do a lot of cooking. They mostly microwave.
One thing that I did when I had an elderly couple, that she was my mentor, and they lived in Lakeland and I'm over here in Apopka. I was in Orlando at the time, is I got these mug recipes where I gave them these giant mugs, and then I made up, you have ingredients that are dry ingredients, and then you have the wet ingredient, and you provide them with little bags with the dry ingredients already in there. And I attached the little recipe to it. She just needed to dump the dry ingredients in, add an egg or add a half a cup of milk, mix it and put it in the microwave for a few seconds.
Right.
Those little bags of, after you give them the mug, the little bags of the recipe ingredients, those were so helpful to her.
We did a breakfast in a mug. They love that. And we did Taste of Home 3-ingredient peanut butter cookies. And back when the hurricane was so bad here, Irma, one of our grandparents raising her grandchildren, they made peanut butter cookies and took to the linemen working on their electric. And so it was a nice way for the families to do something together and to gift the linemen. So it's just trying to find the right recipes that they'll use.
And do you put any mind expanding type things, not LSD, mind expanding like puzzle books, and we do little free libraries, novels or anything like that, but mainly puzzles and exercise books?
We have some of that stuff available, like puzzles and stuff like that, that if they ask for them, we will take it. It's kind of hard when you're delivering. We have a beautiful van that was donated by Fred Roby in the Villages.
Wow.
And when and he's a Rotarian. But when we get all the food bags and everything, and right now we're passing out food bags and laser boxes, and I can't really show you on this, but it's a fantastic box and the people really appreciate it. It has a lot of snacks, which our seniors have been thrilled with, because low-income seniors don't always have access to snacks. They're just trying to afford the real. Yeah, just a minute. My daughter is coming to the rescue here.
Oh, nice.
Can you see? It's got cereal and Oreo cookies and peanuts, crackers, but it also has Boyardee orange juices, a Pop-Tart, Nature Valley granola bar, apple juice, all kinds of things, chili. The people have been absolutely impressed with these boxes. So, so our van has been full, is what I'm saying. So trying to get a lot of other things in there right now is not doable. But no, I mean, we're always open to ideas.
Linda, this is Gloria. I'm sorry I had to leave. We had an incident happen in our neighborhood, but so I didn't get to hear your response. But my question is, have you been approached by hospitals or any organizations, medical organizations, American Diabetes Heart Association, with information to put in your, whatever you give to your senior citizens, just education about heart disease or diabetes or whatever? Have you been approached by that? And let me tell you the reason why I'm asking is because I serve on the board for the National Society of Hispanic MBAs. It's called Prospanica. And there's a concern because a lot of the folks that have the Corvette are minorities. They're either African-American or Hispanic. So I was just wondering if that might be way. I mean, if they have it, they have it. But at least maybe they can control it. Or, maybe there can be some preventative, like stay at home, don't go anywhere, that type of thing. Has anybody approached you about passing out information like that?
That's a very good question. We go to the Lake County Elder Council, and there are a lot of resources there, and they know about us and our red bags. And a lot of those agencies will provide information. We don't put things in for fundraisers, but if there's informational items, we put those in the bags. We try not to overwhelm the bag because we found if too many, they won't read it. But if there's a few things over eating right and all that kind of stuff, and they will read them and they appreciate them. So, and on diabetes and stuff.
Please, thank you. No, because that's good to know that you're able to pass out some information to the folks. And I'm going to share that with our group. I think that's very, very good. And the other thing I was thinking about too, it's kind of a little bit along the line with what Phyllis was saying. So I know you don't want to overwhelm them with all kinds of things, in the boxes or whatever, but I'm thinking of me personally, and who knows, maybe we can see what Rotary can do too, but what is, like, besides the food, and it's kind of like what Phyllis said, what other things do you need, and for the elder?
And I was just going to say, we do a lot of health fairs. Okay. And for those of you that are in business, like the doctor and everything, most of the health fairs are trick-or-treaters looking for the freebies at the health fairs, and they don't even slow down to find out the information they could learn from them. So we found that a lot of the people that need the information to help them don't come out of their apartments because of depression and things like that. So the red bags were one way of getting that information to them. So I'm sorry, what was your?
No, you answered it. You answered it okay. Yeah. So.
But any ideas, we're more than happy to, listen, because we're always looking for ideas. Just the thing that the bigger you grow, sometimes it gets harder. And my office volunteer right now, because of the virus, she didn't want to be in the office. She's going to start working 1 day a week, but it's taking its toll on everybody.
Right. And I was past chairman of Meals on Wheels for Orange County. Okay. And so I think it's great what you're doing. You're complimenting and adding more, because does Lake County have a Meals on Wheels program?
They do have a Meals on Wheels program. Mm-hmm. There's a 2 to 3 year backlog to even get on that program. And the trouble is, seniors wait till the last minute when they're in a crisis situation to even try to get on the program. So that's why we feel like our food bags are so important. And we don't want to just, a lot of food pantries just fill their bags with anything that they get. We want to try to, most of our people have heart conditions or are diabetic. And so we try to buy no salt vegetables. We try to get sugar-free jellies, sugar-free cookies for those that are diabetic. It may be canned goods and microwavable items that we're dealing with, but we try to stay within their boundaries as much as we can. You can't cut totally on the salt, but we can try to improve on it. And as they're, hi Herman, I see you. But as more microwavable stuff, we're even asking now on our food survey, do they use a stove or do they only use a microwave? So we're trying to find out, perfect it even more.
With the homeless that I help in the community here, one thing we put in the request is all pop-top containers and boxes and bags,
Yes.
as opposed to something they need a can opener for. I wish that Barbara Answer had been able to come on. She does a elder program in Pine Hills area, but covers 3 counties. And one thing that she helps with is also electricity, is she has a way to help pay delinquent electric bills for seniors. But they do need to be seniors as opposed to just someone house.
Right. Right. But
Okay.
that's what we do.
Carolyn, do you have some input there?
Well, I've known Linda and Nancy a long time, and so I've always supported everything they do, and we've tried to enhance what we could. But I introduced her to Fred, and I think that was the best thing I ever did. So.
Yes, yes, very definitely. Nancy just wanted me to remind you that, or tell you that we also provide Christmas presents for our clients, and we send out a Christmas list like July or August and try to find out what's on their wish list, and they send it back, and then we work with Bay Pharmacy in Eustis, Bay and Lake Pharmacy, to try to obtain Christmas gifts for all of our people. And some don't want to celebrate Christmas because of their religion, but that's fine. And some have enough stuff, and we understand that too. So, but most people want something under the tree on Christmas morning. We were trying to do birthday parties too, but sometimes that's one of our organizations down in South Lake, Summit Greens Women's Club, take on 24 of our people down there for their birthdays. So we appreciate that. So, any more questions?
Yes, I have a question, Linda. Thank you so much for explaining about the wonderful work you're doing. And I'm sorry if this was covered because my internet broke down in the middle of your talk. I'm sorry, but you know, it's really fascinating to hear about your insights being on the ground with people in their homes. You know, as a doctor who works in the hospital or in a clinic, you see a little snapshot of someone's life, but you're really only seeing a small selection of people who can make it into your clinic or who are so sick that they need to be in the hospital for their will, unfortunately. So I'm curious to know your impressions about substance abuse in people who are homebound and very isolated. Just off the top of your head, I mean, would you say that a significant proportion of the people that you're serving are struggling with maybe a chronic substance abuse problem, or do you see onset of addiction related issues?
I'm going to let Nancy come over. She's actually a nurse practitioner. We don't do medical, but I think she's more, and she was sitting over there not getting on the Zoom here.
Sure.
I'm the silent partner.
Hello, Nancy. Thank you for all your wonderful work. We just heard about it.
Thank you. Most of our clients really can't afford addiction types of medicines. They don't go to the doctors to get the sleeping pills or the other medications. They just, most of them, because of their age and all, just sit at home and they're quiet, suffering in silence.
Indeed. I believe it. Yeah. So yeah, that's helpful information. It's hard to estimate sometimes even the rates of different diseases in people who are not seeking care, who don't have access, or they don't have transportation, or they don't want to go, maybe they don't have insight, or there's so many different reasons why people aren't coming to the clinical services. So I think you really have some valuable insights.
Well, pets make a big difference because they live for their pets.
Yep. I bet. Would you say most people you're serving have a pet at home?
If the Section 8 communities allow it, yes.
Yeah.
Others find a way to get a feral cat or animal as a pet.
It's really an emotional lifeline for a lot of people, even before COVID, and now probably even more so.
Yes.
Great. Well, thank you so
Any
much.
other question?
Not for me. Thanks again.
I do have a question regarding Linda, or Nancy. I'm looking at Linda's name on you.
Okay.
I have had the opportunity to help some people, human trafficking victims, with getting some medical care. Do you ever reach out to medical providers? Because many of them will provide free services. Have you ever reached out to get eyes checked, or to Sertoma for free hearing aids or anything like that?
That's why we go to a lot of the networking meetings to know what's available, especially the free stuff, and pass it along. And whenever they're talking to us or they talk to their visitor from LovExtension, then they'll tell us, well, I have this problem and I need such and such, and we usually can find a resource for them. We also have gently used medical equipment. With Medicare, they only allow you to get one piece of equipment when you're in the hospital. So when you come out, you may have a cane, but you really need a wheelchair. And we're giving out wheelchairs, potty chairs, shower chairs, things like that, all free.
Wonderful.
And they can use them forever.
Wonderful. Thank you.
Dental is a big problem. Let Linda talk to you about dental.
Dental is a big item with seniors. It's so expensive, and a lot of them have broken off teeth and stuff like that. And sometimes the dentist will have once a year, provide a free day, but it fills up fast. But I've tried to get a dental bus to come, but so far I haven't had any luck.
Wonderful. Karen, do you have anything more?
I don't think so, other than to just thank you both for your incredible service over the years. It's truly a lifeline for the people you're serving.
Thank you. And thank you. I'd just like to wish Dr. O the best with her hospital trip, and hope everything comes out good.
Thank you.
So, okay. Thank you very much. Appreciate it.
Thank you.